basically of all non-metro cities except for Jaipur, which is on way of becoming a metro now. So when we start a Lasik practice, it changes our practice altogether because one, it is a heavy investment. Two, we have to deal with a different type of clientele with a different set of expectations, and whether we like it or we don't, whether we accept it or we don't, but marketing is extremely important with a Lasik practice with all its attendant problems. So in a non-metro city, what are the differences? You do have a small volume base, you don't have a large population to cater to. The paying capacity is less, but at the same time, the patient has lesser alternatives. A small city would have 1 or 2 or 3 Lasik centers. So it's not like there'll be a very big, lavish center which will take the maximum share of Lasik patients and the rest of the centers would have nothing to do. And the patients would be less demanding in terms of 5-star facilities that you have to provide at your premises. But we must remember that when it comes to results, they are equally demanding because the profile of the patients is the same. They are young with active lifestyles and they have to live their entire life. In a metro city, you can have various models. It can be a group owned, which has been tried some places, hasn't worked for very long, unfortunately. It can be entrepreneur owned, which is the way the US Lasik practices have gone, but entrepreneurs in small cities are not interested. Or, as is most common, ophthalmologist owned. But whatever the model, the truth is, in India, the majority of Lasik centers are sub-optimally utilized. There are a few centers which have a long list, which have very profitable practices, and they are only very handful all over India. The rest of them are sub-optimally utilized and never utilized to their full capacity. So, considering that it is sub-optimally utilized, Lasik still remains a largely industry-driven thing. It is the industry which pushes the Lasik practice. It is not primarily so much driven by availability of Lasik to correct their refractive error, and are demanding it even in small cities. So when to start Lasik? Of course, if you're a pioneer, it pays you. You are the first to start Lasik in your own city, but it has its own challenges as well. So what is the right time to start? If you have a good practice, do not rush. That is quite explanatory, because in a small city, you are unlikely to have the kind of volumes that you need for a good profitable practice. So to have an exclusive Lasik practice like you can have in some of the bigger cities or with large NRI markets is not possible. But if you start a Lasik, it will be a big boost for your overall practice. And always remember that do not constrain yourself financially so much that the financial issues lead you to relax your screening criteria, etc. So start it at a time when your rest of the practice is fairly well established, your cataract and phaco's are doing well, and you are prepared to feed your Lasik practice for the initial few months if it doesn't go on the way of profitability. Marketing is a must in Lasik and we have to live with it. These are controversial topics. We have terms today like co-management fees, cost per lead, referral incentive, etc., etc. to make it sound more acceptable. But if we use the older terms like fee splitting, it becomes unacceptable. We all are following the US pattern. In US today, there are some insurance companies which actually pay 20% of the fees to the co-managing doctor for the cataract surgery. Lasik, of course, is a different thing because insurance doesn't pay for it. And doctors who do not pay the co-managing doctor are considered to be having old political sentiments. But we must remember whether we have to follow the US model where the economic crisis is largely a result of the health cost, or we have to follow, try our own chart. So co-management at the end of the day is controversial with a capital C, and there is a huge mismatch between the acceptability of this practice among the medical community and the acceptability of this practice among the patients. So it is for every individual to decide whether they want to do it or not. And there are other tools for marketing. Internal marketing in your own OPD. So you must have a large enough OPD base to do this. Employ a Lasik counselor, preferably somebody who has already had Lasik, so this will be very convincing for your patients. Provide information leaflets, very importantly, in the local language. Because it is not just the patient, his parents, his or her parents also want to understand. And many of your patients will be coming from the rural background, girls who want to get married or boys who have been selected for a job and they want to get rid of their glasses for the medical requirements. So print it in the local language. Now the industry people will always tell you something like have 5-star lounge facilities for your Lasik patients because this is the way many Lasik chains which operate exclusive Lasik centers across India are operating. But in a small city it is really unnecessary. You can cut down on the lavish expenses. You have to provide certain basic facilities, but you don't need a 5-star setup like this. Testimonials by previous patients are very convincing for potential Lasik candidates. Get the previous patients to write their testimonials. For example, these are testimonials that have been written by some patients who don't have any problems in doing this. Those of us who practice oculoplastic surgery have always known the value of pre-op and post-op photographs. Unfortunately, in Lasik there are no pre-op and post-op photographs, but you can blow up your testimonials, put them up on display boards, put up the photographs who've undergone Lasik. And the good thing about small cities are that most patients are happy to share their experience. They are very happy to talk to whoever you want them to talk to. They will even write down their address and their phone number, and they don't have any privacy issues or that somebody should not be disturbing them in their home. They are happy to discuss these things with potential candidates. I have a lot of promotional material in your practice and provide information leaflets. Like I said, provide them both in English as well as the local language and distribute them freely among your OPD. They may not help you directly in today's date, but they will either help you at a future date, or if nothing else, they will benefit a colleague in some other city where your patient may go and get a Lasik done. So in the long run, it is always good for the entire ophthalmic community to spread as much awareness about the new technology as we can. Have a good launch for your Lasik and create a buzz in the city, because in a small city, everyone will come to know that you have a new machine or a new practice. Focus on the target audience, for example, call centers, colleges, private banks, multinationals, where there are young employees who want to get rid of glasses and who have the paying capacity to do so. And encourage parent participation, because in small towns they will always come with their parents, not alone. Use the internet. The target group for Lasik is very internet savvy. There are many methods. We may be familiar with different methods, but diversify your strategy. You can use free online directories or blogging in your website if you have a hospital website. Reviews can be put up on the internet. Use social media like Facebook and Twitter, and whatever else you're comfortable with.
Help me, Dr. Vidushi, please.
Okay, this is, for example, videos on YouTube. This is Facebook. It's a closed community. Anyone you put up, all the friends would come to know. Do not overtrust optometrists. In metro cities, optometrists do all the pre-op evaluation, etc. But here we have small volumes. Do not overtrust optometrists, and these optometrists are not equally trained to handle all the pre-op evaluation. In all this marketing, do not oversimplify it, and do not take it as a less serious business or become relaxed about your screening. There was an Indian eye controversy. The corneas are thinner. You have to exclude them. Lasik pricing, controversial issue, but in a small city, keep many options so that majority of your patients can afford it, and negotiate better with industry, because at the end of the day, the prices are high because of industry. So to conclude, when you start Lasik in a non-metro city, it is just like a safari here. The lucky ones.
One thing, even in the metro city, doctor, they